Afternoon. Thank you to the conference organizers for inviting us to be here today. For the clicker. My name is Bob Proulx. I'm the president and general manager for Silicon Biosystems here in the U.S., and I'm joined today by Giuseppe Giorgini, our CEO. I'm here to tell you about technology and a company that I think really embodies the idea of this meeting. It's a very innovative technology that came out of the University of Bologna. It was originally a PhD thesis for one of our co-founders. It utilizes a combination of electronics, microfluidics, and biology to really tackle a problem in today's healthcare industry. And it's getting at the ability to look at very rare cell events like circulating tumor cells, stem cells, or things like fetal cells in the maternal blood, and enabling the scientists and the clinicians to be able to understand the biology of those cells and what drives the disease. And we do that by having automated the entire process. So unlike other methods that might not make it in the clinic, this is a very automated method, and so it can be implemented in a diagnostic type of setting. But in keeping with the theme, let's look at why this Italian technology might matter to the world. So we know today that, in fact, we've sequenced the human genome, but we don't really know today much about how those genes affect the disease. We also know today that increasingly pharmaceutical companies are looking at a way to pair their therapeutic product to markers, biomarkers, that help identify responders from non-responders. Does my drug treat this patient effectively? Herceptin from Genentech being a good example. If you're a HER2 new positive breast cancer patient, the drug will work for you. But if your breast cancer is HER2 negative, don't bother to take Herceptin. It's not going to work. Okay? So increasingly, the healthcare industry is looking at ways to be more effective in treating patients. And so it's important that we begin to look at and understand the underlying biology of these cells. On the left-hand side of the screen are normal white blood cells collected from that sample, and on the right side are metastatic breast cancer cells. And what this really does is it looks like we collected the cells, we analyzed the DNA, and what you see on the right-hand side on the bottom is a graphic that shows the variation in the DNA. There's very little variation. But on the left-hand side, if you look at the cancer cells, you can see all kinds of additions and deletions to that DNA. This is an indication that these cells are rogue, they're mutated, there's something wrong with these cells. This is the nature of metastatic breast cancer cells. If you're familiar with cancer, you're quite familiar with the fact that people don't typically die from the solid tumor. The solid tumor is treatable, surgically removable. These cells that are released by the solid tumor put into the blood and then take hold somewhere else in the body and cause more tumors. It's this our ability to get to the underlying understanding of the nature of these cells, these metastatic cells, that's going to help drive the next level of treatment for patients. So how do we do that? Our technology, as I said, was based out of the University of Bologna, some very clever engineers that came up with this concept of using a dielectrophoretic force, electronics, to control the manipulation of cells. It's a highly patented. We have 27 patents issued on this, so our strong IP portfolio. And we have a single-use consumable that's used as part of the process. So let's look real quickly at how that works. So this is a cross-section of our microfluidic cartridge where the sample is actually processed. And what you see on the bottom of this is the series of electrodes that's controlled, and on the top is another electrode. And where the electronics are in phase between the bottom and the top, you get this ability to have cells or particles naturally gravitate to this position because the other electronic forces cause the cells to go to this place. We can control all the electrodes individually. So what happens is if we want to collect and move an individual cell, we simply reprogram the array, we move the electronics, and what happens is the cell travels with the electronics. So now I have the ability to individually control and move cells. So if we look at the top of we look at a picture looking down on the top of our cartridge, what happens is a sample is going to get injected into our consumable device. And we're going to then image this sample to look for the cells of interest. And let's say in this case these green dots represent the metastatic cancer cells I'm interested in, and the red dots represent other cells that I don't care about. What we can now do is, thinking back to that last image, I can now reprogram the array and move only the cells that I want up into an area where we can park them separate from everything else. And then I can choose to collect them and program the array and move them out and collect them either one at a time or in groups. So now that I can analyze those cells individually or in groups. Totally unique in the marketplace. There is no other technology available today that can take individual cells, collect them with 100% purity, for molecular analysis. So our business plan is a classic, what we would call a razor blade plan. We have an instrument that we can sell, and then we have a consumable device that gets sold with it. We're going to start with clinical research and then build towards the diagnostic applications. And we'll begin to add products to our portfolio that include upstream and downstream processing for those samples. Ultimately, this will require us to go to the regulated bodies like the FDA to get clearance for use for the product for diagnostics. We address very large markets. So we'll start with the research market. This is typically a $250 to $500 million market, and move towards the diagnostic market, particularly in oncology. And if you think about it, we're agnostic to the kind of cells that get treated, so we could go after things like fetal cells in maternal blood. Imagine being able to look at cells from a blood sample and not have to undergo amniocentesis in order to be able to do testing for heritable disorders or things like trisomy 21. We have a very good management team. The company was started by two gentlemen from the University of Bologna. Giuseppe Giorgini joined the company in 2005 and began to raise capital. Giuseppe comes from a background where he started the Amgen subsidiary in Italy. I've got 25 years in marketing and sales experience in the United States for instrumentation and diagnostic companies, so we're quite comfortable with this platform and our ability to bring it to the market. We currently have strong financial position. We've got about 30 employees. We are in a revenue mode. We're not pre-revenue, so this year we expect our full year revenues to be around $9.5 million, and we expect to be cash flow break even if we hit our numbers this year. And this, let me make clear, this is not a technology risk. This technology is well proven. The patent portfolio is strong, developing the commercial applications and developing the diagnostic applications. And like everybody else, of course, our expectation is that this will lead to our ability to go to the public markets if we maintain strong financial picture, and or we're a potential acquisition target for companies like Illumina, Life Technologies, or the big players in the diagnostics market. We have a table outside if anyone has additional questions for us about how we might use the proceeds of our next financial round. I also have a movie that can show you that shows how the cells are actually manipulated. And again, I appreciate the opportunity to be here today.